Welcome to NCLEX Map, where we turn knowledge into confident action. Today we're diving into the first and most critical part of the priority setting framework, airway management, the foundation of life. When the airway is compromised, every system is at risk. The airway is the passage for air to enter and exit the lungs, and it must always be clear. Even a brief obstruction can lead to irreversible brain injury in minutes. That's why, in clinical care and on the NCLEX, airway always comes first. Every time you assess a patient, ask yourself, can air move freely in and out? If not, nothing else matters. A blocked airway is the most urgent emergency, and your response must be immediate. Recognize the signs early. Listen for stridor, gurgling, or snoring. Watch for drooling, retractions, or paradoxical chest movement. Silence can be more dangerous than noisy breathing. It means no air entry. A Glasgow coma score of 8 or below means the patient can't protect their airway. Be ready to intubate. Common causes of airway obstruction include swelling from anaphylaxis, trauma, or foreign body obstruction. Never delay airway assessment in any unconscious or post-surgical patient. Your immediate interventions follow a simple sequence. Position the head to open the airway. Use the head tilt chin lift unless spinal injury is suspected. Then use the jaw thrust. Suction secretions promptly and insert airway adjuncts if ordered and tolerated. If these steps fail, call for advanced help immediately. Prepare for intubation or emergency tracheostomy, and always apply oxygen as prescribed. In a team setting, one nurse manages the airway while another monitors vital signs. Let's apply this to a scenario. A stroke patient lies supine, drooling, with gurgling sounds and low oxygen saturation. The priority is to suction the airway, elevate the head of the bed, and apply oxygen. Never attempt to feed or give fluids until airway protection is assured. In another case, a post-operative thyroidectomy client suddenly develops stridor and difficulty speaking. This signals laryngeal edema and airway obstruction. Call for rapid response and maintain airway position. In trauma or spinal injury, avoid head movement and use jaw thrust to open the airway. In burn victims or anaphylaxis, anticipate airway swelling and intubate early. Remember, children's airways are smaller and easily obstructed. Monitor for nasal flaring or retractions. Evidence confirms that a patent airway ensures oxygen delivery and lowers mortality in critical illness. Every nurse must assess the airway before addressing pain, comfort, or teaching interventions. When you see terms like stridor, choking, or GCS-8, prioritize immediate airway management. Don't choose assessment or comfort options when the airway is compromised. Remember this clinical rule. If the airway is obstructed, don't assess, act. In NCLEX, airway threats outweigh all other priorities unless cardiac arrest has occurred. Combine knowledge with vigilance. Reassess airway patency after any intervention. Document breath sounds, oxygen saturation, and interventions. Effective airway maintenance saves lives every shift. In summary, airway first. Without an open airway, breathing and circulation fail. Recognize the clues, act rapidly, and always be prepared for escalation of care. Your calm, evidence-based response defines nursing excellence. If you found this breakdown helpful, imagine how it can transform your NCLEX preparation. Like, share, and subscribe to NCLEX Map, where every insight brings you closer to clinical mastery. Stay sharp, stay compassionate, and see you in the next presentation. Breathing, the power of ventilation.